Before watching this video, click on the subscribe button. The Inderal contains propranolol hydrochloride tablets and it is available as 10 mg, 20 mg, 40 mg, 60 mg and 80 mg tablets for the oral administration. The inactive ingredients in Inderal Propranolol are lactose, stearic acid, magnesium stearate, microcrystalline cellulose and other ingredients. Indications: the beta blockers are usually used for the treatment of high blood pressure and the anxiety, as well as the treatment of hypertension. It may be used alone or used in combination with other antihypertensive agents, particularly a thiazide thyroidic. Inderal is not indicated in the management of hypertensive emergencies. The second one is atrial fibrillation. The atrial fibrillation is an irregular and often rapid heart rate that can increase your risk of strokes, heart failure, and other heart-related complications. The myocardial infarction is also known as heart attack, and it occurs when the blood flow decreases or stops to a part of the heart, causing damage to the heart muscle. The most common symptom is chest pain or discomfort, which may travel into the shoulder, arm, back, neck, or jaw. Migraine. A migraine is a primary headache disorder characterized by recurrent headaches that are moderate to severe. Typically, the headaches affect one half of the head, are pulsating in the nature, and last from a few hours to 3 days. And associated with the symptoms may include nausea, vomiting, and sensitivity to light, sound, or the smell. Angina pectoris due to the coronary atherosclerosis. The angina pectoris is basically a medical term used for the chest pain or discomfort due to the coronary heart disease, and it occurs when the heart muscle does not get as much blood as it needs. This usually happens because one or more of the heart arteries is narrowed or blocked, and also called as ischemia. Essential tremor. The essential tremor is also known as the brain disorder that causes a part of your body to shake uncontrollably. The unintentional shaking motion is called the tremor. The hands and forearms are the most commonly affected areas. Pheochromocytoma. The pheochromocytoma is a rare tumor of adrenal gland tissue, and it results in the release of too much epinephrine or norepinephrine hormones that control the heart rate, metabolism, and blood pressure. Hypertrophic subaortic stenosis. The hypertrophic subaortic stenosis is a disease characterized by a marked hypertrophy of the left ventricle, involving in particular the interventricular septum and the left ventricular outflow tract. Now I am going to discuss the dosage. So the amount of dosage depends upon the gender, male or female, body weight, and how severe is your condition, the background of individual therapy or combination of drug therapies, and the quantity of medicine or mg of medicine. Do not skip the dosage or stop using the propranolol medicine suddenly because it may worsen your condition. So how can you take this medicine? You can take this medicine by mouth or as directed by your doctor. Take this medicine with or without food. Do not chew, crush and break it. Swallow it whole. And now what about the side effects? So the degree of side effects are depending upon a person to person body mechanism. Some of the persons may experience severe side effects while some may experience serious side effects, in which the most common side effects are including slow or uneven heartbeats, wheezing or trouble breathing, shortness of breath, sudden weakness, loss of coordination, depression, confusion and hallucinations, cold feeling in your hands and feet, nausea, loss of appetite, upper stomach pain, tired feeling, dark urine, headache, fast heart rate, sore throat, burning in your eyes, skin rashes, and the sleep problems or insomnia. While the overdose symptoms may include slow or uneven heartbeats, dizziness, weakness, fainting, so consult to your doctor and seek for medical emergency if you are experiencing some of the severe side effects, and ask your doctor for a complete list of side effects. Prevention. When not use a propranolol tablets, so you should not use the Inderal Propranolol tablets if you are allergic to any one of the inert components. Don't use its tablets if you have the following conditions such as asthma, slow heartbeats, serious heart condition like sick silent syndrome, AV block, or the pregnancy. You should tell your doctor about your medical history, background, other diseases and medication therapies as well prior taking the propranolol tablets in order to reduce the side effects. What about the interactions with other medicine and diseases? So the propranolol tablet may interact with different kind of medicines including vitamins, herbal supplements like blood thinner, warfarin, gentlemen, antidepressant drugs, amitriptyline, drugs for the treatment of high blood pressure, drugs for the treatment of prostate disorder, steroid medicines and non-steroid anti-inflammatory drugs like aspirin, brufen, meloxicam and naproxen. So the Inderal tablets may also interact with different kind of diseases including slow heartbeats or low blood pressure, congestive heart failure, depression, liver disease, kidney disease, thyroid disorder, and tumor of the adrenal gland.